Hello students, we shall learn about the next emergency situation or a condition called as pulmonary edema. So from the term itself, pulmonary means it's indicating the lungs and edema means there is fluid buildup. So pulmonary edema, the meaning of a condition which is caused by excess of fluid in the lungs. Now, this can also occur because of a heart condition. Now, we are learning here cardiovascular. So, why we are learning this as a emergency condition is when there is a disease of the heart, or when there is the heart is in a condition or a situation where it's not able to perform effectively, this can put a lot of pressure and congestion even on the pulmonary system. So, I think we have learned this in a few conditions that we have learned until now, and this is what causes the fluid in the lungs. So, when this happens, what's going to happen to the patient is, yes, there is definitely going to be breathing problems, because this fluid buildup in the lungs is not going to help the lungs perform effectively, means in the exchange of gases. And the other reasons to this also, maybe especially it can be worsening in a patient who is already having asthma or any other lung infections or lung disorders, and also when a person is living at high levels or altitude. On up the mountains or up the mountain top and at high elevation. So, what happens is even the atmospheric oxygen is going to be less, and with this condition and when the weathers as even the cold climatic conditions, all this can put a lot of pressure on the patient, and this condition can get worsened in such people as well. Okay. And sometimes it so happens that pulmonary edema can be, as I mentioned, it can be the result of a heart condition, and it can usually become severe and starts developing over a period of time. It begins off when a patient will start showing symptoms like mild to extreme breathing difficulties. There can be always a cough associated with it, even chest pain, fatigue, dyspnea, very, very important. Feeling of weakness as well as malaise, cold, clammy skin, and definitely the weakness and lethargy again is because of the patient is in a low blood pressure, hypotension is going to also be there, and overall the patient is going to be feeling very lethargic and not in a position to carry on his normal physical activity. Now, this picture here shows you the normal lungs, what it looks like on an X-ray maybe, and also the other picture is showing you what is an edematous lung. So, you can see how much of that, the white patchy part of the lung is actually the fluid in the lungs. Okay, so even when you take an X-ray, what it looks like in the following slides. What goes on here is, as I mentioned, due to this heart condition, it can increase the pressure and causing congestion in the pulmonary system. So, the little air sacs or the alveoli starts getting built up with this fluid. So, you can see the small tiny, the pigeonholes that you can see, the bluish liquid in there. So, that is nothing but fluid. Okay, and what happens because of this fluid? There is not going to be gas exchange taking place. Okay, so that is important for us. We are sending the blood back for purification, and the purified blood from the lungs are actually coming back to the pulmonary veins into the left atrium. Now, in a condition like this, what's going to happen? The heart is not going to be receiving this purified blood, and again it's going to be this deoxygenated blood that is going to be circulating in the patient's body, and that is what puts the patient into a lot of fatigue as well as weakness and dyspnea conditions. Yeah, this is exactly what I was telling you about the X-ray. Now, a normal lung looks like this, and you can see the haziness on the chest X-ray where it's indicating pulmonary edema. So, this is how it hazy and very cloudy appearance. So, that is what it looks like. And the classification of pulmonary edema, it normally classifies into the main important one. You can classify it as cardiogenic pulmonary edema and non-cardiogenic. So, means cardiogenic is associated with the cardiac conditions or disorders, and non-cardiogenic may be any other conditions or illnesses or disorders apart from there's other ways of classifying it as well. The types will also include cardiogenic pulmonary edema, non-cardiogenic pulmonary edema, as well as neurogenic pulmonary edema. So, this can be associated with any sort of head injury as well. Now, cardiogenic, again, it can be, as I mentioned, any sort of diseases, illnesses or disorders of the heart. Non-cardiogenic may be any other conditions. It could be due to some problems with your gastrointestinal system, any sort of drugs, when there is a sepsis, toxicity as well. Pneumonia, that is again a lung condition. Smoke inhalation, especially when there is a fire, and when the patients, when people have been trapped in the building or due to some fire accidents, inhaling a lot of that smoke again can cause this kind of condition, and any other sort of malignancies and infections and inflammations in your system, the other organs can also put a pressure causing this particular condition. And neurogenic pulmonary edema means any sort of head injury, trauma, anything like that, accidents. So this can also result in a condition. Now, what are the causes again? Causes again here is being explained to you as per the classification of cardiogenic and non-cardiogenic. So with the cardiogenic, again you will see all the causes are related to the cardiac condition. So obviously by now you know what are the problems that are causing the cardiac condition, so you can put them all together. It can be any sort of disorders, like right from your atherosclerosis, coronary artery disease, the heart failure, cardiomyopathy, arrhythmias, infections and inflammations of the heart, like myocarditis, pericarditis, endocarditis, valvular heart disease of any sort, even when there is any kind of immune system disorders as well, which can cause pressure on the heart and resulting in this condition. Also any sort of drug usage as well. Okay. Now, non-cardiogenic means, as I mentioned, it is not cardiac related. Any other disorders in your heart related to your GI system, your respiratory system, your nervous system, your kidneys, anything, any other important organs, any other system, even if it's your comorbidities, conditions, if it's worsening, anything. So related to your circulation aspect. So anything of that can also result in this particular condition called as non-cardiogenic pulmonary. Eventually what is going to happen, all this is going to put a lot of stress and pressure on the lungs, and eventually the patient is going to be finding it very, very difficult from his normal breathing. The other causes will also include hemodynamic, again related to your the blood pressure and also your lymphatic system, again if there's any sort of obstruction. Microvascular injury, again any sort of toxic injury, when there is pancreatitis, trauma, shock, anything like that. So microvascular, even the smallest blood vessels, so that is what it means by that. And if there's any kind of rupture, anything in your, even when there is sepsis, like toxicity in the blood, even that reason into the bloodstream, all this can cause disorders, and this can cause problems to the important organs, and it can result in this particular. Now, as I mentioned, high altitude. So people living in high conditions, as we know, the atmospheric oxygen levels are quite low, and especially when in a condition like this, yes, there is going to be problems breathing, and as it is, the weather is going to be very cold. And due to this again, and especially when the person is having lung conditions or lung disorders, it's going to make it extra difficult. So during this condition, what happens, there is definitely going to be decreased oxygen levels, and because of this, it's going to put a lot of the vessels gets constricted, like narrowed, and because of this again there is going to be a lot of congestion, and also there is going to be increase in the capillary pressure. Capillaries are nothing but your fine or small blood vessels, and with this stress, what happens, sometimes there can be also a rupture of these capillaries, and eventually what's going to happen, it can result in a condition called as HAP or HAPE, as you call it, HAPE, which is nothing but high altitude pulmonary edema. Again, all this, so you need to instruct the patients, especially as I mentioned to you, the patients living in high altitudes, the cold weather conditions, up the mountain top. So again, it's due to and again, as I mentioned, because of all this, again, if the patient is not mostly used to doing heavy physical activity, that again is going to cause a lot of problems in the breathing, because as such of his lung conditions, and if he's still performing his trying to perform his exercises, again all that is going to put extra pressure. So in all such conditions, it's up to the nurse to counsel and educate the patient about how much of physical activity is the best for him. Now, high altitude pulmonary edema, this is just showing you in detail about the picture here of the lung and the tiny blood vessels, like the air sacs. Okay, so how it gets filled with this fluid, and because of that, the exchange of gases becomes very difficult. So pathophysiology, that's exactly what I just explained to you. So increase in the fluid in the spaces in the lungs, again, is going to cause a lot of pressure, causing the inability for the exchange of gases to take place. There's going to be damage of the epithelium, and finally there is going to be accumulation of fluid in the alveoli or in the means again what's going to happen, there's going to be congestion, accumulation of fluid, and this is going to put a lot of pressure again back into the pulmonary system, and because of this there's going to be pulmonary hypertension, and that causes the maybe again the pressure in the capillaries, as I just mentioned, and finally there's going to be accumulation of fluid resulting in edema. The important clinical manifestations will be extremely short of breath. So severe dyspnea will be there. The patient is going to be feeling very suffocated, wheezing, gasping for breath, cold and clammy skin, anxiety, restlessness, a cough, a very nagging cough actually, and cyanosis that's very clearly seen because bluish discoloration of the lips, the fingertips. Again, all this is because of the lack of oxygen supply, a rapid and an irregular pulse as well. So nothing but palp. Again, the long-term signs symptoms will also include, difficulty in breathing, especially even while you're lying. It's going to be very difficult when the patient is lying flat, and going to make it worse, as I mentioned to you, when the patient is exercising as well. So it's very important for the nurse to counsel and educate the patient and the family about how much of physical activity is the best for him and according to his condition. And also because of this, yes, there is not going to be much of a movement, so activity intolerance is going to be there, resulting in maybe a rapid weight gain as well, and also swelling of the lower extremities is nothing but the edematous condition. All this is because of the pressure on the heart, causing pressure in the vascular system and causing the pressure in the blood vessels as well, eventually showing it on all your extremities as well. So this edematous condition. With this, again, there's going to be a lot of fatigue, weakness, and also lethargy and inability to move around. So all this is the signs of the symptoms the patient is going to be exhibiting. Now, the most important complications with this condition will be edema. Ascites, again, as I told you, edema, ascites is nothing but fluid buildup in the abdominal cavity, pericardial effusion or the pleural effusion, as I mentioned to you. Again, this is nothing but the fluid buildup in the pleural cavity. Congestion and swelling of the liver, again resulting back in the myocardial infarction. Again, it's something but the heart condition, cardiogenic shock, arrhythmias, electrolyte imbalances, and also definitely finally what happens if there is severe difficulty in breathing, the patient can end up having a respiratory arrest and eventually leading to death of the patient. How do we diagnose this particular condition? Yes, a thorough physical examination, history collection, very important to begin with, and followed by an X-ray, very, very important. Also sending off your bloods for arterial blood gas investigations. You need to really check the values of your oxygen levels, the carbon dioxide levels, and also the ratio. And importantly, you need to know this in detail. Then we need to do a right heart study and a left heart study, which is performed in the cardiac cath lab. So what this procedure is going to do is it's going to be checking the pressure in the heart, okay, in the different chambers of the heart, putting the catheter in, and this will also give the treating doctors an idea about what is exactly happening to the patient. And sending the blood for a complete check, so a complete blood profile. Also in case if there's any kind of infection suspected, then also sending the sample for blood cultures, also very, very important. Management for this, yes, once a patient comes in, yes, very important is to remove the distress. So ensure that you provide the patient a comfortable position, setting up and also administering oxygen, very important, monitoring the patient, hooking the patient onto the monitor, recording the ECG, blood pressure, and also making sure you record the saturation, the respiratory rates, the pulse, and administering nitrates, which is going to improvise on the blood pressure as well, and making sure he has a cannula in, and in case of any emergency drugs to be administered, so make sure that it is it's patent. Also, in case oxygen administration should be maybe with a CPAP, which is something but continuous positive airway pressure, using a mask has to be given, and also considering the medical management in case of inotropes, nitrates, also hypertensives, like in case checking on the patient's blood pressure, especially when he's already a hypertensive patient, making sure all the parameters are under control, and also preparing for mechanical ventilation. And now the management, this is actually explaining to you in detail about what we need to do and how to address the patient immediately. So this is just giving you a picture about how to provide the immediate treatment. So position, comfort, oxygen saturation, monitoring, recording, and also administering nitrates, making sure he's got a clear IV access, sending the bloods for investigations, monitoring and recording the ABGs, that is arterial blood gas levels, obtaining a 12-lead ECG, and continuous monitoring is very important, and also inotropic support, which is nothing but helping the cardiac, helping the heart in its contractile functions or contractility functions, helping it to pump effectively. And especially when it is a totally respiratory oriented, then make sure you do all the tests and checks Make sure you administer the bronchodilators. In case there's an infection in the lungs, and make sure the antibiotics are started off quickly. But before that, you need to check if the patient is allergic to any of them, and depending on that, you administer the medications. So the management will, this is what it is, the medical management, and it's also able to, so that's immediate medical management. And the nursing diagnosis, the nursing management, as I mentioned, again, the nurses has the duties of physical examination and history collection, and the nursing diagnosis will include, obviously, yes, there is going to be difficulty in breathing or impaired gas exchange, anxiety, activity intolerance, and also nutritional imbalance, risks for the complications, and eventually deficient knowledge. Nursing intervention is very important. You make sure the patient feels comfortable, promoting his breathing is very, very important. So making sure you give him a proper position, promoting oxygenation, administering oxygen, making sure he's sitting in a follows or semi-follows position depending upon his comfort, and also recording adequately his parameters, and also following the doctor's order. Making sure the chest X-ray is also done, listening to the chest, make sure you don't listen to any sort of breath sounds like crackles or rails, and again watching out for the education and prevention, or the home remedies will include controlling the blood pressure, like the comorbidities, avoiding the cause of this particular condition, quitting smoking, and making sure you come out of all those unwanted lifestyles like smoking, alcohol, eating a healthy diet, maintaining a healthy weight, and also making sure you're exercising up to how much you're. Okay, and with that we finish this topic. Thank you for your time.